It's another beautiful Sunday in the month of May. Welcome to Osun in Progress, a weekly program that showcases activities and achievements of Governor Gboyega Oyetola in the state of the virtuous. Our focus today is on health, and we'll be looking at the activities of an agency established to ensure affordable healthcare service delivery to residents, irrespective of their status. We are talking about the Osun Health Insurance Agency. We'll be speaking with the Executive Secretary of the agency, Dr. Niyi Ogini, who will be speaking on the activities of the agency in the last few years. My name is Rafiu Hamid. But before then, let's look at the activities of the state government for the week. The week started with the return of over 600 passengers who had come to celebrate Eid al-Fitr in Osun State from Lagos through the free train service provided by the state government under the leadership of Gboyega Oyetola. The return train had on board students of a private school in Okini who were on excursion.
The students about this train, but they've not even had the experience before. But now, when I heard that the state government have, presented the train, that's why we've come to embark on the journey from Osogbo to Ede.
This is the first time I've been seeing a train, and in fact, this is the first time I've been boarding it. I expect to see more terminals, but I think the first terminus to this place is Ede, so I'm expecting to see a lot of great things.
The train had brought over 1,000 passengers to Osogbo few hours to Eid al-Fitr celebration. On Tuesday, the weekly civic engagement program of the Osun State government was held in Ile-Ife. Thousands of participants, including people from informal sector, religious leaders, market women, community leaders, politicians, and the physically challenged, attended the event. The participants commended the governor for his style of governance. They also made some requests from the state governor.
Let me commend His Excellency for coming to our aid. There is an ongoing project at Iloro Agan to Agan Police Station, which the governor is doing personally. So I have to commend the governor. There are some areas, so there are some roads that needs the government's attention. For instance, about 5 or 6 roads. So I want to implore the governor to, at least as he did in Agan, to come to our aid also.
More roads to be built. More roads. They are doing the roads, but not enough yet. So we would like them to concentrate on more roads. And then there are some schools which has become rotting.
The special advisor to the governor on civic engagement, Olatunbo Osun, reassures residents of the state that no local government will be left unattended to in terms of people-oriented projects.
I must tell the whole world that the governor of the state of Osun is making a lot of impact at the community level, at the local government level, and at the state at large. Carry people along, irrespective of religions or tribes, making all the people, the association, the groups, making them to be a stakeholder and be the part of decision-making and policy formation of his government.
Same day, the state governor declared open the 45th annual conference of the Soil Science Society of Nigeria at the Bowen University in Iwo. Represented by his deputy, Gboyega Oyetola, the governor described the topic as apt.
It is not worthy that Soil Science Society of Nigeria comprises leading experts with the sole objective of advancing the study of soil through comprehensive and methodological approach for the purpose of promoting and fostering understanding of basic and applied soil science. Obviously, your contributions to earth living and food security through sustainable ecosystem have tremendously helped humanity to survive and sustain existence despite doubting natural challenges.
The theme of our conference is of the 45th Annual Conference of the Soil Science Society of Nigeria is understanding soil organic matter dynamics, key to sustainable ecosystem health and food security. I won't do the work of the keynote speaker, but I want to say that for us at this side of the world, organic matter becomes very important for sustainable soil health.
Nigeria, yesteryears, we saw a diversified economy that was predominantly agricultural. We saw food self-sufficiency with exports of several major cash crops like cocoa, cassava, and you can go on and on. But today, we're seeing a mono economy. We have moved from food security to food insecurity. We have moved from boom to doom. And we have moved from self-sufficiency to self-dependency. From exporter to importer.
On Wednesday, a workshop and training on investment certification exercise and stakeholders engagement forum was held in Osogbo. The workshop was organized by the NIPC in collaboration with the Osun State Investment Promotion Agency, OSIPA.
This is the turn of the state of Osun. So we're working, aside from helping the state to create investment promotion commission, we also assist states in part of those tools in getting a compact understanding of those tools that we use to drive investment. And one of those is this NICPS, which we call Nigerian Investment Promotion Certification Program.
On Thursday, the State Deputy Governor, Gboyega Oyetola, flagged off 2021 Cocoa Farming Initiative Scheme in Ile-Ife, Osun State. The Deputy Governor says over 2,000 cocoa farmers are to be supported with necessary facility in the state to realize the dream of making the state the largest producer of cocoa in Nigeria.
Our administration is working tirelessly to support maize, cotton, and rice farmers to boost their yield and enhance food production and food security. This arrangement is designed to power the Osun Food Support Scheme to feed our people, boost food production, ensure food security, and provide jobs for our people. The rice component of the scheme is, for instance, sourced from local rice sellers in order to encourage and empower local farmers in the state and beyond.
This year, 3,000 farmers of their members will be able to access the inputs to support and nurture their cocoa farms. When we continue to support each other this way, with the partnership of the farmer, owing into their commitments, repaying their loans and their obligations, we definitely can continue to support the program and expand our partnership across the state of Osun.
I think Osun State now is, like, if I'm right, one of the top 5 producing cocoa states in the country. And we're looking for how we can get into the top 2. I think this kind of initiative and scheme will help the cocoa farmers in the state. We're hoping this kind of empowerment will encourage more youth to get into cocoa farming.
On Friday, the Director General of National Institute for Legislative and Democratic Studies, Professor Abubakar Suleiman, paid a courtesy call on the state governor in Osogbo. He came to solicit the support of the governor so that the State House of Assembly will key into the program of the institute.
Your Excellency, sir, we observed in the last 10 years The parliament or the parliamentarians in Osun State has not keyed into our program. It's the only institution in Nigeria. It's the only institution in West Africa. About other 33 states have been benefiting tremendously from the services of these institutes. The issue of the harmony between labor and governments has been very, very improved upon. Before you came, we used to know what happened. I want to commend you. I want to commend your efforts. From the depths of the leadership of the National Assembly, you have done very, very well.
Surprised that we have not keyed in. I'm surprised because we need it. So now that we are aware, and I've been told that it's actually even free of charge. So I don't know what we're waiting for. I'd like to tell you, with all sincerity, that we're going to take advantage of this.
Also on Friday, members of the All Progressives Congress (APC) in Atakumasha West local government area of the state endorsed Governor Gboyega Oyetola for another term in office. They said his achievements in different sectors of the economy informed their decision.
We reviewed the state of governance and polity in Osun State since the inauguration of the incumbent governor, Mr. Gboyega Oyetola, in November 2018, and the progressive steps his administration has taken in revamping the economy of the state, improving the security of lives and properties, prompt payments of full salary of civil servants and pensioners, rejuvenating infrastructure in road construction, implementation of the educational reforms, revitalization of 332 PHC and general hospitals, re-engineering of the agricultural revolution to engage thousands of unemployed youth, improving the economic and financial base of the state, consistent servicing and repayment of loans and debt incurred by previous administration. As duly recognized body within the APC family and structure within the state, we are satisfied with all the developmental growth of Oyetola's administration. We hereby restate our unalloyed allegiance and loyalty to his leadership and administration as the leader of the party in the state, and hereby adopt him as the governorship candidate for the APC in 2022 election and support him wholeheartedly for his re-election.
What we are doing is to disassociate ourselves from a group called the Top. That's the Osun Progressive. That none of members in Atakumasha West belong to this group. We have one party, which is APC, and we have only one chairman that is acting in that capacity now. So there is no Congress yet. So they should wait for the time. So we don't want this stuff to destabilize our party in this local government. That is what we are doing here today.
To tell the whole world that APC in Atakumasha West local government is one, and it's an indivisible body. We are waxing stronger every day to make sure we don't give room for any opposition in this local government. That is why the governor is winning, and he's winning hands down.
Osun State Health Insurance Scheme is a decentralization of the National Health Insurance Scheme. Since the agency was established, residents, irrespective of their status, had benefited immensely from the services of the agency. The impact of the agency are also felt at the grassroots through both government and private hospitals. The Executive Secretary of the agency, Dr. Niyo Ogini speaks further about the achievements recorded so far.
It's almost becoming a household name, particularly in the big cities of the state. We have not penetrated the hinterlands as much as we would have loved to, but you can see, day before yesterday, I was in Abagboro. Abagboro is in Ife Central Local Government. You wouldn't believe that such a village existed in Ife Central Local Government. But I was there personally, and I was speaking with the KBAC. So what has changed? We are combing the nooks and crannies of this state to ensure that the people who are resident in this state are, they take maximum advantage of this laudable project of the administration of Mr. Gboyega Oyetola to ensure that they are in good health. And what is so good about it, we are enrolling, you can see, I just printed this out. This is just the summary of the activities of yesterday and the day before yesterday for the vulnerable populations. What we have here is for pregnant women, this is status of OI's priority population program enrollment. Yesterday and the day before. Pregnant women, 25. Children under 5, 87. Aged, 772. Physically challenged, 58. People with special needs, 243. The poorest of the poor, 563. We have here 1,702 that have been covered. Our target is to cover 40,000 vulnerables. Not only in one place, in the local government, the 30 local governments and the area office. We want to cover 40,091 persons. And this is just in 2. If you are a poor person and you are pregnant, every poor pregnant woman, every poor under 5 child, every disabled person that is unemployed, because there are some people living with disabilities that are richer than me because they have employment and things like that. But there are some people living with disabilities that are truly vulnerable. They don't have any means of livelihood. So all those truly vulnerables, we have gone through their leadership, Jonah Preed. So they are bringing them all in different categories, the blind, the lame, and all kinds of things. Even the albinos, we have also,
How much?
Oh, not a kobo. They would not, all of these people I'm talking about will not have to pay 1 kobo to access care based on the benefit package of Osun Health Insurance Scheme. This is our benefit package. It contains a lot of, interventions, from minor ailments to even surgeries, including major surgeries. Yesterday, I got a report of one of the patients that we did hysterectomy for. She had endometrial cancer. And of course, because she was having the conditions, they didn't diagnose the cancer until we operated, and then we removed the mass. When we did histology, it was cancer, a civil servant. Now, because this scheme is growing, you're asking me what has changed. Initially, when we started, there is no way we can even talk about, taking care of somebody that has cancer in this scheme because it's outside the benefit package. But right now, the patient has been operated, histology has been done, and then referral has been made to UCH where she's going to do radiotherapy. And both the radiotherapy and the chemotherapy we will be able to cover because the scheme is growing bigger and bigger. What has changed? Many of the care providers in this state, in all the big cities that have been on NHIS, have now seen how reliable, much more reliable OHIS, that is OIS is, and you can go to interview those providers. You can go to Jalemi, you can go to Ilesha, you go to Obadele Memorial, you can go to Ife, you go to Living Hope Hospital, everywhere in big cities. Ask the providers which do they prefer to work with, NHIS or OIS. They will tell you that OIS money will come first week of the month. They get their capitation, it doesn't fail. Aside from that, their enrollees also, our enrollees are so happy because if an enrollee gets to a hospital and the hospital doesn't take care of the person well, we are just one phone call away. You make your phone call to us. From the call center, it will be escalated to the Director Standards and Quality Assurance. If you cannot solve it, it will be escalated to me. Within 30 minutes, maximum 1 hour, you are getting solutions. So the enrollees are also happy that they can be in a place in the field, they have issues, and they call, and within 30 minutes, 1 hour, their problems are solved. We have testimonies that abound of such experiences of people. And what has changed? What has changed is that we are touching even the government facilities. Government facilities that are accredited under the scheme now have more money more money to be able to, plan for development, both infrastructural development and personnel, human resource, development, both at the level of the primary healthcare, secondary, and tertiary. Just 2 weeks ago, this agency paid the sum of 154 million from the Basic Healthcare Provision Fund to the 332 primary health centers in the state for services that they rendered in 2019. Now you can see, because we just got the funds to start implementing that under the Basic Healthcare Provision Fund. So what has changed? Those facilities, some of them were 1.8 million naira in a primary health center. Now you can imagine the effect of 1.8 million naira in a primary health center. We have told them to develop their quality improvement plan, which will be in the 3 legs of personnel, of infrastructure, and equipment, and then consumables and medicines, so that at any point in time, even in those primary health centers, you would have the basic minimum to give good service, and whatever they are not able to handle, they are going to push to the contiguous secondary health facility, which is also accredited by OIS. Whether it is private or public, anybody in this priority population program will not have to pay a couple. There will be a seamless referral from the primary to the secondary facility where you'll be taken care of, even including surgeries.
He also speak on the projection of the agency for the year.
Our projections for the priority population program is 40,091, like I said. At the moment, before this 1,702, we already had 6,300. So plus this, we have 7,000. Now that's 8,002. That will be 8,002 now. With this figure that I just received this morning, that will be 8,002. We are going up to 40,092. That's for the priority population. For the formal sector population, that is the civil servants, we have covered the entire civil servants. Have covered the entire civil servants in terms of, because since we started the deduction of the civil servants, premium from their payroll, that means automatically all the 41,140 as at the time we started, that was in 2019. There have been a lot of attritions now from those who have retired and everything. But then when we started, we captured all of them in terms of payroll deduction. And then we now started onboarding them. We gave information that every civil servant should come and obtain form so that they can do the enrollment into the scheme with their dependents. But many people in the civil service, they say this thing cannot work. That it's a lie. What is it that government will do that will work? So for between May and October 2018, people had apathy. By 2019, when we started service delivery, and they saw that we were doing operations and things, the civil servants now started to regularize their enrollment. We started payroll deduction. So some people, it was after a year of payroll deduction that they came to start enrolling. But as I speak to you right now, we have altogether both the civil servants and their dependents. We already have first we had 75,000. That is amongst the ones that were initially captured. The recent ones that we have done in the last, since the NSAS project, they have been coming to this facility themselves to say they now want to put themselves and their dependents, has been 17,000. So we're talking about going to 92,000 coverage for all the civil servants and their dependents, aside from these 8,000 now, which we have for the for the priority population program, which is the vulnerable persons program. And this is jointly sponsored by the federal government through the Basic Healthcare Provision Fund and the state government through the Equity Fund. This is what sponsors this one, and that's where we're going. The population, our own target for the entire population in Osun for this year is actually to ensure that we hit about 15% of the entire population. Projection is 5.2 million persons. At the end of this, year, we expect that we would have gone up to 500,000. 500,000 will be 10%, of the entire population. That is 520,000 persons. Will be 10% of the 5.2 million. We know that these are just projections, but we are trying as much as possible to ensure through the accelerated, marketing to the informal sector, which is what we have started now. We have as our goal this year to have come up to 520,000 people by the end of the year. That is what we are planning to do. For only 12,066 naira as an individual, you can register and you will receive treatment from a very robust benefit package for 1 whole year. And as a family, for only 57,600 naira, yourself, your spouse, and your biological children, up to 4 under the age of 18, will enjoy this robust benefit package for the whole of the year. This is, it's something like we have never had before. We must give thanks to the government of the day and the commitment, particularly that the governor, Mr. Gboyega Oyetola, has shown to ensuring that this scheme succeeds.
That's Osun in Progress for today. Join us next Sunday, same time, for another edition of the program. On behalf, that's the package for today. Join us next Sunday for another edition of Osun in Progress. On behalf of the coordinator, who doubles as the State Commissioner for Information and Civic Orientation, Funke Egbemade, and the entire production crew, my name is Rafiu Hamid saying, do have a great week ahead.